We have to push harder to get Oregonians the treatment they need and deserve. I think we all know there's simply too much pain on our streets, in our homes, and in our schools. Although there's much yet to do, we have made some progress. Last year, after the finalization of a study I commissioned to understand regional treatment gaps, I identified a target of adding 465 new treatment beds by the end of 2026. There's now a public online dashboard so we can track our progress with the investments already in the pipeline. To strengthen the workforce needed to help more people, I have focused on eliminating the backlog at Oregon's health licensing boards so qualified counselors and social workers can get to work. But there has to be more done to meet people's needs. My recommended budget for the next 2 years continues to deploy a dual strategy of increasing treatment capacity and strengthening the available workforce, with $90 million for another 363 treatment beds and $50 million to bolster the provider pipeline and stabilize worker retention. And it's not just about money. Complex problems rarely are just about the money. I want Oregon to do more intentionally and strategically to help individuals living with serious mental illness. Finally, before I move on to education, I want to emphasize that we cannot overlook our children and our youth. Too many of Oregon's kids are struggling with things they shouldn't have to deal with, from homelessness to acute mental health disorders to addiction. We have to help our children and youth now so they have a better, healthier path to their future. That means painting with a broad brush for better outcomes in every aspect of a child's life, including improved access to behavioral health care, working toward better outcomes for children in the state's care, and working to address youth homelessness.